3 patients succumbing to the disease, pushing the country's fatality count to 364. And as Brian Otieno now reports, the government says these high numbers could be as a result of the fact that many infected people are not seeking treatment.
In the past week, the country has recorded double-digit deaths. The 23 people who succumbed to the disease in the last 24 hours, taking to 53 the number of people who have died in the last 3 days as a result of COVID-19. The country's case fatality rate stands at 1.6%, lower than the global rate of 3.8%, but the rising number of deaths is a major concern.
We are increasingly seeing younger and younger people passing away, and therefore we want to urge the young people to desist from as much socializing as they are. They have continued to do so, even in homes and so on. We want to ask to desist. We want to urge that people stop socializing.
And now it is emerging that many Kenyans are not seeking medical attention when they fall ill, leading to a spike in COVID-19 related deaths.
But you can have a very serious COVID disease condition, but you may not be aware. You would behave normally, but when you reach the hospital, the doctors will quickly usher you into the critical care when they look at your oxygen saturation. So there's something in COVID called happy hypoxia. It means your lungs are not working optimally, but you feel otherwise well. So the message to Kenyans is that if you feel unwell, please seek for healthcare services support.
Since the outbreak of the disease in the country, the government has decried low number of patients visiting health facilities as some Kenyans keep off hospitals for the fear of getting exposed to the virus. Among those claimed by the virus is Dr. Ken Ouko, a renowned sociologist and a lecturer at the University of Nairobi. Meanwhile, the country's virus load has hit 21,363.
727 people have been confirmed positive out of a sample of some 6,371. We are also pleased that 254 patients have recovered from the disease.
The Ministry of Health is warning that the coronavirus will still claim more lives in the country, hence the need for strict adherence to the safety guidelines. Brian Otieno, KTN News.
COVID-19 is real, so don't forget to observe the safety measures. And if you get any symptoms, seek medical attention. Now, Kenya has moved to diffuse what appears to be a diplomatic tiff with her neighbor, Tanzania. According to Transport CS James Macharia, Tanzania has not been exempted from the list of inbound